Hello, my name is Annie Turnbull and I'm an occupational therapist working in the cardiac and the critical care rehabilitation team at the Bristol Royal Infirmary. So this presentation is going to be about cognitive changes following cardiac arrest. So what is cognition? It refers to a combination of processes in the brain including memory, language, thinking and the ability to learn new skills. Tests may be undertaken to determine if there are any problems with these cognitive functions. So what causes the cognitive change? So during a cardiac arrest, the blood stops flowing through the body. Loss of consciousness occurs straight away, which is the result of blood, oxygen and other nutrients not reaching the brain. Without prompt intervention, this will lead to damage within a few minutes. Performing CPR helps to keep some blood flowing through the body and reach the brain and other organs. This buys time and allows the use of a defib to shock the heart into a normal rhythm. After a person has been shocked and their heart has been restarted, they may not regain consciousness straight away, and if they do, they might be confused and require urgent medical attention. Most people following a cardiac arrest will spend some time in an induced coma in intensive care during the initial stages for monitoring, treatments and investigations. During this time, they will need help with breathing and feeding and will be looked after by a skilled team of nurses and doctors, but they will have no awareness of this. So the lack of oxygen to the brain, known as hypoxia, is what can lead to the damage. So common difficulties that people face. Most survivors will not remember the moments immediately before their cardiac arrest. Some may retain memories of the hours to minutes before they collapsed, but others will have lost many days or even weeks before their event. Many of these memories will not come back because the brain did not have enough time to store them before the person became unconscious. This is very normal. It's a physiological process and affects all cardiac arrest survivors to some extent, whether they have had a brain injury or not. Sometimes people experience what is called a delirium. Please see the other delirium presentation for more information. So if the confusion is severe and persists for many days with little change, further tests may be completed to see if any damage has occurred. Sometimes doctors do not see any brain damage on the brain scans, but if the cognitive problems persist, this could still be suspected. When patients suffer a brain injury, this can present in many different ways, including cognitive and sometimes physical difficulties. Occasionally, some people may have mild confusion and a slight decline compared to their normal functioning before the cardiac arrest, which may be evident to family members, but not always obvious to the treating team in the hospital. It is perfectly fine to discuss any concerns about this with the hospital team. The chances are that these problems are mild and transient. If appropriate, an occupational therapist will be involved to investigate this in more detail. The most common cognitive skills affected are memory, attention, and what is known as executive functioning. That is, a set of skills that help you to get things done by planning and organising. Cardiac arrest survivors may also be unaware of their difficulties or severely underestimate them. These difficulties are similar to those caused by delirium, but usually do not improve quickly and do not recover completely. It may be difficult for doctors and therapists in the early stages of recovery to say if confusion and poor memory are due to delirium or brain injury. Some people may also present with specific problems, in particular, if they have suffered a stroke at the same time as their cardiac arrest, they could have problems with vision, speech, with moving or feeling parts of their body. All these problems will be investigated by the hospital team and likely require a period of rehabilitation. So recovery and going home. For many patients, some cognitive problems can linger into the days or weeks after discharge from hospital. Commonly, they do not remember much about their hospital admission, in particular the first few days, which can be quite upsetting. Some also find that they may go blank when they are talking or forgetting simple words or losing the thread of conversation. although this often comes back with time. People may also struggle to focus and pay attention and have mental or physical fatigue, and can affect the number of things they do during the day and for how long they can do them for. It is also worth mentioning that some people experience a period of anxiety and low mood after discharge, which can also affect memory. Very often, difficulties will improve quickly in the first few weeks after discharge. However, around half of cardiac arrest survivors will still experience some mild problems with their thinking skills around 6 months after cardiac arrest. People have described these as frustrating rather than life-changing, and often consist of forgetting bits of conversations or information, such as shopping lists or names of people. People also sometimes struggle with multitasking. These difficulties are not expected to get any worse. However, they can become more noticeable when returning to demanding activities like work. For many patients, it might be advisable to postpone important decisions for at least a few weeks after being discharged from the hospital to make sure they focus on their recovery first. So some patients may have a more complex recovery. Once their cardiac problems have been addressed, they might be transferred to another hospital or neuro-rehabilitation facility. Rehabilitation can be focused on both physical recovery, if the survivor needs to relearn how to walk or look after themselves, and also cognitive recovery, if a brain injury has occurred and they need help with cognitive strategies. The current provision of rehabilitation varies depending on somebody's home address and their location. Some survivors with more mild to moderate difficulties may be able to access outpatient appointments or community at-home rehabilitation, although this also depends on where they live. The hospital therapy team, or your GP, should be able to advise on what rehabilitation and follow-up options are available. As discussed, a common difficulty following cardiac arrest is not being able to remember things. It's worth mentioning no one's memory is perfect. Some people may be naturally better at remembering things and conversations than others. Other people may be better at remembering more visual things, such as images. So some internal strategies to think about are reducing distractions to try and maximise your attention, things like reducing background noise or trying to focus on one thing at a time. Repeating the same information several times can help you learn. You can also try and chunk items together, for instance, in a shopping list, chunking the vegetable items together, then the drinks items together, etc. Visualise and creating an image in your mind of what you need to remember can also help. So also some external strategies to think about are diaries, daily planners, calendars, using whiteboards or post-it notes to jot things down to help you remember. Also think about using your smartphone or tablets to set reminders and help you plan important things such as appointments. Medication blister packs or dosette boxes can be useful if you're needing to take lots of medications. In general, people tend to find it easy to use strategies they were already using before the cardiac arrest, as it's more familiar to them, although it is possible to learn new skills with patience and perseveration. Thank you very much for listening, and I hope this is helpful. Please speak to your ward team or occupational therapist if you have any questions. Here are some useful resources if you'd like to have a further look. Thank you.